Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Then, chemotherapy in carcinoma breast. In carcinoma breast, we can give first in carcinoma breast therapy the generation regimen. The first generation regimen for carcinoma breast include we can give 6 monthly cycle of you will give cyclophosphamide with methotrexate and 5 fluorouracil are given. Okay, so these will reduce the risk. They will reduce the risk of relapse over a period of 10 to 15 years. Then then this CMF regimen is not used now. Okay, now we have modern regimens. These modern regimens are actually anthracycline based regimens. These are anthracycline, sorry, these are anthracycline and taxanes based regimen. So the main combination effect is C. Now the most popular regimens are actually CMF regimen or CAF regimen. Sorry, this CMF regimen is used now, but it is not considered as adequate adjuvant therapy. It is not considered as adequate adjuvant therapy. It can be used, but it is not considered as adequate adjuvant therapy. So we use CAF most commonly. CAF includes cyclophosphamide, adriamycin, and 5-fluorouracil is a better regimen than CMF regimen. Now in United States we have newer regimens are being followed like adriamycin with cyclophosphamide plus taxanes are given. These taxanes can be either docetaxel or paclitaxel can be given. Okay, so these both one of them are given and this is called as polychemotherapy. Then if the tumor is HER2 positive, if it is a HER2 positive, we can add trastuzumab can also be added. Trastuzumab is added if there is HER2 positive regimen. Then anthracycline containing regimens can also be given. Anthracycline containing combinations are significantly better than having these anthracycline combinations are actually better than CMF regimes. Then what are the so this is about the thing about chemotherapy.
thank you and thank you for watching.